Welcome to the DPN Deep Dive. This is where we give you brief overviews of research from the journal NPP Digital Psychiatry and Neuroscience. Today, we're jumping into something pretty important, psychotic disorders. Specifically, how can we track symptom changes objectively? Almost like vital signs, right?
Exactly. It's a
Yeah.
huge challenge, and
Oh.
current methods aren't always scalable or easy.
Right. But there's new research suggesting maybe automated speech and language analysis could be a way forward, something non-invasive.
That's the focus today. We're looking at an article called Automated Speech and Language Markers of Longitudinal Changes in Psychosis Symptoms.
Yeah.
For Dr. Sunny X. Tang and colleagues. They're at the Feinstein Institutes for Medical Research and the Donald and Barbara Zucker School of Medicine.
Okay, great. So Dr. Tang and the team, what did their study actually involve? How did they set it up?
Well, they worked with 66 participants who have psychotic disorders,
Wow.
and they assessed them at several points in time.
Multiple time points.
Yeah, when they were first admitted as inpatients, then again at discharge, and followed up at 3 months and 6 months later. And at each point, they collected speech samples, things like reading a paragraph, describing a picture, even journaling out loud.
Okay, so different kinds of speech tasks.
Right. Then they used automated acoustic analysis and also natural language processing, NLP, to look at, get this, 357 different speech and language features.
Wow, 357. That's a lot of data points per person.
It is. And the main goal was really to see if these objective features, these speech markers, could actually track how the main psychosis symptoms changed over that whole time period.
So connecting the speech data directly to the symptoms, what was the kind of headline finding?
The really striking thing was they found a single component score, sort of a summary score representing global speech features, showed significant links over time
A single score linked
to all three major psychosis domains: thought disorder, negative symptoms, and positive symptoms. So this one measure, distilled from all that complexity, seemed to capture something fundamental. And interestingly, the way it related to symptoms changed over time across those different assessment points.
Okay, that's powerful. A single metric reflecting those major areas. Can you dive a bit deeper? Like what specific speech things were linked to, say, thought disorder?
Yeah, definitely. For thought disorder, which often involves, disorganized thinking, the analysis linked it to more subordinated constructions.
Subordinated constructions. What does that mean in plain terms?
It's like layering ideas excessively, making the communication less direct, maybe less purposeful, almost getting lost in clauses.
Okay. Makes sense.
They also found it was linked to being less efficient when describing elements in those picture tasks, and also a reduced semantic distance between sentences.
Semantic distance, like the conceptual jump between ideas.
Exactly.
What about negative symptoms then? Things like reduced motivation or expression,
For negative symptoms, the links pointed towards decreased speech complexity
less complex speech. How did that show up?
in a few ways. Using words that are more easily visualized, fewer adjectives and adverbs, those descriptive words, also fewer connections in their speech graphs.
Speech graphs, like mapping how words connect?
Sort of, yeah. It
Yeah.
maps the structure. And they also saw a higher average semantic distance between sentences. So bigger jumps, suggesting maybe less elaboration, less connecting of ideas. And these links, for negative symptoms, they actually became clearer later on at the 3 and 6 month follow-ups.
Interesting. Maybe as the acute phase settles down.
That could be part of it, yeah.
Yeah.
Allows those more stable trait-like features to emerge, perhaps.
And positive symptoms. That category seems broad: hallucinations, delusions.
You're right, it is heterogeneous. So the overall domain didn't show links quite as clearly, but individual positive symptoms did yield some insights.
What?
Well, for instance, suspiciousness seemed related to using fewer nouns, and hallucinations showed connections to using words typically acquired earlier in life, and also greater semantic distances, interestingly.
Specific links even within that broad category.
Exactly. And it's worth mentioning most of these relationships held up pretty well across genders and races, although they did know some interactions with race, particularly some differing patterns for participants identified as white or Caucasian.
Okay. So these are really intriguing findings, but like all studies, there must be limitations, right? And what's the bigger picture implication here?
Absolutely. A key thing is this study looked at symptoms concurrently with the speech. It wasn't designed to predict future symptoms, which is, a different question.
Right. Correlation, not necessarily prediction at this stage.
Precisely. And while it's a significant longitudinal study, 66 participants is still somewhat small for really complex machine learning models. Also, that single global score, while significant, it only explained a relatively small percentage of the total variance in symptoms.
Which isn't too surprising, maybe, given how complex psychosis is.
Exactly.
Yeah.
Speech is clearly a signal, a valuable one, but it's just one piece of a much larger puzzle.
Right.
That's pretty standard in biological and clinical research.
So bringing it back to our listener, what does this research mean for you? Well, it feels like a really crucial first step, doesn't it?
I think so. It's paving the way towards tools that are objective, scalable, and low burden. Tools that could really change how we monitor and manage psychotic disorders.
Yeah, you can imagine getting more precise treatment adjustments, maybe catching relapses earlier, intervening faster.
Potentially reducing rehospitalizations, speeding up how we test new therapies. It really hints at this future, where subtle changes in just how you talk could provide real-time clues about your health.
So the main takeaway then is that these automated speech and language features show real promise. They could be objective markers, tracking not just overall severity, but maybe even different types of symptoms in psychosis.
That's right. And maybe a final thought for you listening is just how these subtle shifts in our everyday language, things we might not even notice, could actually hold such deep, dynamic insights into our health and well-being.
A powerful thought indeed. Thank you for joining us for this DPN Deep Dive.